Hello and welcome back to 90 Seconds Healthcare. Some of our videos, as you know, are around 90 seconds, other are a little bit longer. Some of these are because we felt that there's a need for longer videos or came as requests. My topic today is so important, so please be attentive. So many misconceptions. I'll be brief and highlight the cardiac risk factors and only drawing your attention to what I think is key and important. So please stay tuned. Please stay with us. If you like our videos, hit the like button, share them, and subscribe. The heart, I don't have to remind you, is a remarkable organ beating from day one till the end. Something really amazing, very dramatic when there are symptoms with the heart. And many patients come to my clinic and other cardiology clinics with major concerns, and they say, I wish I took care of myself better. I wish I took seriously the cardiac risk factors. I wish the videos, the comments from my physicians and nurses, from my friends and community members, I took significantly more seriously. Please remember, healthcare is very reactive. We want to be proactive. Prevention. Many insurance companies are unfortunately globally not focusing on prevention. And I think all of us need to be hands by hands, together working on preventing cardiovascular disease. Acute coronary syndrome, or what you call a heart attack or an instability of the heart, is a very serious event. When it happens, unfortunately, it happens very quickly, very fast, and immediately patients may feel a sense of doom, a sense that something great happens, and they become very scared. And the appropriate thing is to simply remind you then, with these symptoms occur: chest pain, shortness of breath, severe palpitation, neck pain, things that are suddenly acute in the area of the thorax and the abdomen, consider as one of the differential diagnoses a heart attack. Then wherever you are, we need to call the ambulance to be transported to the nearest facility and have it addressed. So this is just a reminder. Please remember that acute coronary syndrome or heart attack occur with these very important arteries, two on the left, one on the right. We call them coronary arteries. Hardening of the blood vessels, what we call the plaque, occurs, and then a clot is formed using platelet and other sticky material. This thing typically happens very quickly. The plaque occurs over years and years. So while the event is sudden, it was happening slowly and being planned for over years and years. So the best thing we could do is not simply to say this happened, there's nothing we could do about it, is to prevent it in the first place. And it is feasible to prevent it. Again, please remember, we're talking about narrowing of the blood vessels and preventing a heart attack or instability of the chest pain that you have. So the risk factors are the ones that make it more likely for the patient to get heart disease and heart attack, and they are divided into two groups: the one that we can't do much about, the non-modifiable one, and the modifiable one. The non-modifiable one are important not because we can do something about them, but we can be more mindful, we can be more careful, we can mitigate, address the risk by saying, hey, if there is a family history, if my age is whatever, if my gender is whatever, I need to be even more careful than my friends and colleagues. So age, as you know, is key and should not be belittled, especially men above age 45 and women above age 55. Can we get heart attack before? Sure we can. I've seen patients in the 30s and 35 and even younger. So it's very important to remember that these are risk factors, but things can still happen sooner. Men and women can have heart disease, and heart disease is a number of reason for death, number one reason for people to die, no matter what their gender is. However, men somehow are more likely to have heart disease than than women, but female or women after menopause, especially within 5 to 10 years, are almost equal to men. Family history is very important. We mean parent or sibling, and we're talking about having heart disease in men before age 55 and in women before age 65. Please be attentive to this. I know there are so many cool videos with music and fun stuff, and I know talking about illness is not fun, but preventing the illness is the utmost happiness. And please consider it seriously. Modifiable risk factors are quite a few. The first one is hypertension or high blood pressure. It can damage the blood vessels and not only cause heart disease, but very importantly, stroke. And this is true for all the cardiac risk factor. We're talking about the cardiovascular, so they can affect all the blood vessels. High cholesterol, especially the low density lipoprotein or LDL. L should be low, and hence we want the LDL to be low. And there are guidelines on how low should low be depending on your risk factors. And please, any of those 1 and 2 million follower videos saying that please do not worry about cholesterol, it's not true that it causes heart disease, please do not take them seriously. Cholesterol, LDL, is not a hypothesis, it's a fact. It causes vascular disease and heart attacks. Smoking is a very significant risk factor, works on so many ways to make the blood sticky and cause hardening of the blood vessels. In addition, any form of smoking, we're talking about cigarette smoking, pipe smoking, water pipe smoking, any form of e-cigarettes, electronic cigarette, can cause heart disease. And please remember, not only heart disease, but lung disease and cancer and many other things. Diabetes, especially if uncontrolled, is a major risk factor for vascular disease, both in the heart, in the brain, and in the legs. Obesity, especially central obesity. We're not talking about beauty. We are all beautiful. So this is not an aesthetic thing. It's a scientific, medical, cardiac thing. Is associated with heart disease. Physical inactivity. What do we mean by physical inactivity? All of us should walk at least 30 minutes daily. If we cannot walk, find some way to be active. Unhealthy diet, especially the saturated and trans fat diet and the high salt diet. Increase your intake of fruits and vegetables and fibers. You still can eat red meat and definitely fish, but make sure it is balanced. And alcohol consumption, the fallacy of alcohol consumptions. Alcohol can make our heart weaker and can increase blood pressure and increase risk factor in so many ways. So with you, with Dr. Samer Ellahham, cardiologist, I truly want us to work together on preventing heart disease. I am aware of so many of the videos and the things talking about these things from my colleague. Please take these videos seriously, mine and others talking about cardiovascular prevention. Stay happy, stay healthy. Take care.